Show. Health Minister Dr. Zweli Mkhize will this morning release TB prevalence survey findings. It'll focus on the TB disease burden in the country, COVID-19 impact on the treatment and care for patients and interventions to ensure service continuity. Let's take you there live now.
1.89. It was also very high in young people, 15 to 24 years old, 2.91. And also, if we go right down to the bottom, it was 2.88 amongst those who were older than 65 years. Now, our other objective was to look at healthcare seeking. In this slide, we present the proportion of participants who were screened, who had symptoms and reported that they did not seek care. It is a busy slide, but I'll just highlight 2 or 3 things. So overall, if you look at the very top bar, we found that 66.6% of the participants who had one or more of the TB symptoms reported that they had not sought care for their symptoms at the time of the survey. If you look at it by HIV positivity, it was more in those who were HIV negative. And by age group, we can see that it was greater proportion in those who were younger, 15 to 24 and 25 to 34. And by sex, we can see that it was more in males. So more than about 2/3 of the people did not seek care, mostly in younger people, in males and those who were HIV negative. In terms of the reasons why people did not seek care amongst the participants, here people could choose more than one response. The majority of them said they were still planning to go and seek care for the symptoms, which was 60.2%. There were those who regarded their symptoms as not being serious, which was just 26.6%, and the rest 6.5%, and said that they had no money to travel to the facility or the facility was too far away from them to get to. In terms of where people sought care for their symptoms, we analyzed this amongst the TB cases that we identified in the survey who were symptomatic. I think this is no surprise. Most of them said that they sought care from the community clinic. A few attended care at the private in the private sector, and a few went to the government facility, to a government hospital. Just to note that amongst these cases, 42% of those who were diagnosed with TB in the survey had sought care, meaning that the remainder had not yet sought care for their symptoms. So I'm moving on to the conclusions now. So the conclusions and the recommendations. So what we found was that South Africa has a high TB burden, including many people with undetected TB in the community. And this is granted within the context that there's already been a lot of progress made in the past decade, as was said by the Deputy Minister. The estimated number of cases was more than the cases notified, and we've spoken about where the largest gaps are in the younger people, in older people, and also in males. So some recommendations are that we need strategies to detect TB in young people and older people, and this could include expanding youth-friendly services and facilities and leveraging on other programs, use of technology and health solutions to reach more people and facilitate entry into care, strengthening integration of TB diagnosis and care into that of chronic conditions, including non-communicable diseases, and also not forgetting to target the elderly because there was a big prevalence to notification. For conclusion and recommendation 2, we found that there was a high burden of TB in men. This is not something new or unique to South Africa. It's been found in many surveys across the world. And the strategies that we recommend are that we need to reach men, and the strategies can include integrating TB screening into men's health programs, using the social networks and other men's forums to reach men, and also using technology.